Well, good morning, everybody, and welcome to the Swim Towards Stewardship Informational webinar. My name is Kate Carpenter, and I'm a clinical quality consultant and Swim Towards Stewardship project manager at the Iowa Healthcare Collaborative. On behalf of the entire Swim Towards Stewardship project team, I want to thank you for joining us this morning. The purpose of our session today is to provide competent hospitals who may be interested in participating in the Swim Towards Stewardship project a detailed overview of the project work and provide you with some instructions and next steps if you'd like to participate. Of course, we want to provide everyone with a chance to ask their project-related questions, and we won't be getting into project content today, but we will have time for this as we advance into the project, and we've got a robust subject matter expert team that we've built with a lot of muscle in the way of expertise and experience who will be providing content and support for hospitals throughout the course of this project. And I'll introduce you to them shortly. Before we begin today's session, I would like to give you some instructions for navigating today's Zoom meeting. We want to make sure that you are dialed into today's session by audio so that you're able to ask questions later in the session if you don't have computer speakers. Here are some instructions on how to do that. After clicking the Zoom link, you can click Join by Phone as seen on your screen. Use the dial-in number and enter your meeting ID. Please also do enter your participant ID when prompted. That will link you to your Zoom webinar so we don't see you twice in our participant list. We do ask that you do mute your phone or audio, and you can do that either manually or on your phone by pressing *6. Zoom is a webinar system, and it has some functions that we'd like to show you how to use. In the bottom left-hand corner, you'll see headphones or a microphone icon, depending on how you're linked to audio. If you see a red line through that, you are currently muted. During today's presentation, the default will be to have everyone muted to avoid background noise. The next icon over is the video button. You may or may not have video capabilities on your computer station, but for today, please disable your video. In the middle of the toolbar, you'll see a set of buttons, and today we'll be mainly using the participant and chat functions. The participant button shows you everyone who is participating in today's meeting, and you also see the chat icon further to the left. If you have a question, you can enter that into the chat or send it to a group or a certain participant during today's session. I'll be monitoring the chat throughout the session when we'll answer any questions that have been entered there during the Q&A towards the end of the hour. So just a few additional instructions before we launch today. This session will be recorded and transcribed, and we'll provide you, following today's session, we'll email all participants with a link where they can access this presentation along with the slide deck and relevant project materials. This recording will also be posted in the Innovation Resource Library. Okay, so without further ado, here's our agenda for today. We've worked through our welcome work. We'd like to give you a brief snapshot of stewardship and an introduction to our Swim Towards Stewardship project team. We'll go through the project outline and then overview the requirements to participate. We'll close the hour with a Q&A and then give you some guidance on next steps before we adjourn today's session. Okay, so as we kind of get going today, I wanted to center us all on why stewardship is so important. And I thought I'd do that this morning by highlighting some of the information available through the CDC website. Antibiotics have transformed the practice of medicine, taking once lethal infections readily treatable and making other medical advances like cancer, chemotherapy, and organ transplants. This prompt initiation of antibiotics to treat infections has been proven to reduce mortality and save lives, with a recent example being the rapid administration of antibiotics in the management of sepsis. However, 20 to 50% of all antibiotics prescribed in the U.S. in acute care hospitals are either unnecessary or inappropriate. Any medication can have serious side effects, and for antibiotics, those side effects can include adverse drug reactions and C. diff infections. Patients who are unnecessarily exposed to antibiotics are placed at risk for serious adverse events with no clinical benefit. And the misuse of antibiotics has contributed to the growing problem of antibiotic resistance, which has become one of the most serious and growing threats to public health. Unlike other medications, the potential for spread of resistant organisms means that the misuse of antibiotics can adversely impact the health of patients who are not even exposed to them. The CDC estimates more than 2 million people are infected with antibiotic-resistant organisms, resulting in approximately 23,000 deaths annually. In 2014, the CDC released the core elements of hospital antibiotic stewardship programs. And with this document, the CDC gave a framework and sort of set some expectations of who should be involved in stewardship and what stewardship programs and hospitals might do. In this document, they outline the 7 core elements of stewardship. And I want to just give a quick touch on all 7 of these. First of all, a leadership commitment. This is necessary to help make sure that we're dedicating the necessary human, financial, and information technology resources needed to be successful. Accountability is really appointing a single leader for responsibility for the program. So we refer to this in the Swim Towards Stewardship project as your team leader. Third is drug expertise. And this means appointing a pharmacist leader who's responsible for working to improve antibiotic use. 4 is action, implementing at least one recommended action, such as a systemic evaluation of ongoing treatment needed after a set period of initial treatment, like an antibiotic timeout. These really are like your day-to-day interventions. Tracking, this is monitoring antibiotic prescribing and resistance patterns. Reporting is speaks to the regular reporting of information on antibiotic use and resistance to doctors, nurses, and other stakeholders. And lastly, education, that it's important to educate our clinicians and our healthcare team, and also our patients and families about resistance and optimal prescribing. So when we say antimicrobial stewardship, what do we mean? And here's a really good definition. Antimicrobial stewardship is a multidisciplinary program of activities that optimizes antimicrobial use in order to improve clinical outcomes and minimize unintended consequences of antimicrobial use. So I think, across the country, all the attention paid to stewardship, there's a lot of different goals, certainly, that we can achieve with our steward efforts. But I think we can all agree on these 3. We want to optimize patient safety and outcomes. So we want to get patients the right antibiotics so they have the best clinical outcome, but also so that they have the lowest risk of having an adverse drug event. We want to reduce resistance. We hope that we can reduce antibiotic resistance, not only overall in our patient populations, but also for our individual patients. And decrease or control costs. We want to optimize patient safety, but we think that those outcomes will also decrease costs, specifically in pharmacy and lab. They'll tie to decreased length of stay and so on. So I think it's important to know, as we kind of launch into the Swim Towards Stewardship project, that there's really a multitude of efforts that have been going on locally for years that we really have an opportunity to build on. And so I just want to highlight a few of those. So we have several early adopters of antimicrobial stewardship, local hospital leaders here in Iowa and South Dakota, in our neighboring states that we can really pull expertise from. And also support through local agencies, the Iowa Hospital Association, SADAHO, IHC through the HIN, Pelican, Iowa Department of Public Health, and our pharmacy associations. These folks have been leading different initiatives and lending support in the way of antimicrobial stewardship for years. Also in 2007, ARC, in partnership with Johns Hopkins, launched their stewardship project, and we have a lot of hospitals participating in that work currently. In April, just a few months back, Iowa hosted the Antimicrobial Stewardship Program Summit, and many of you attended that event. And so this project is really an opportunity for us to continue to build on this work. So I want to introduce you to the project team we've put together for the Swim Towards Stewardship project. Myself, I'll be leading the project. We have Sarah Durr, who's the medication management lead at the Iowa Healthcare Collaborative. Terry Hewlett, who's an infection prevention consultant and educator at Infection Prevention Strategies. Lisa Vitale, who's a nurse clinician at the Iowa Department of Public Health. Dr. Luis Castagnini, he's assistant professor at the Department of Pediatrics for Baylor and the Children's Hospital at San Antonio. Also, we have Nancy Wild, who we don't have her picture quite yet, but we'll get that pulled in for webinar 1, but she's a member of our team and she leads antibiotic resistance over at the Iowa Department of Public Health. We also have an additional pharmacist, Jeff Brock, who's infectious disease pharmacy specialist at Mercy Medical Center here in Des Moines. So similar to how we've kind of developed a multidisciplinary team to help guide the work of this project, we'll be encouraging you to do the same. So be thinking about different clinicians, department heads, who you have in the way of infection prevention, quality improvement staff, lab staff, maybe IT, and certainly nursing leaders that could help you in your stewardship work. Okay, so let's start talking about the project framework for Swim Towards Stewardship, and I'll read an excerpt out of the project flyer. The Compass Inn is offering a unique opportunity for 5 hospitals to join a small cohort on a guided swim towards stewardship. Using the fishbowl technique, participating hospitals will receive customized coaching from a project team of subject matter experts who we just met. Participants will use the new Iowa Antimicrobial Stewardship Program Toolkit as a framework as they progress through the project together. Hospitals that already have an established antibiotic stewardship program and/or hospitals that aren't quite ready to make the commitment towards implementing an ASP will still have an opportunity to participate by observing the cohort from the Sandbar. On the Sandbar, hospitals will be able to watch project activity from outside of the fishbowl, learn from instruction, and enhance their knowledge as participating hospitals share their journeys on the Swim Towards Stewardship. So you may be asking, that all sounds well and good, but what exactly does she mean by fishbowl? This is something new that we haven't done as a Compass Inn network, and so I wanted to explain that a bit. The fishbowl technique is a way to manage group discussions, projects, and activities. We know at times it can be difficult to have open and meaningful dialogue amongst participants when the group is very large. This technique allows for a smaller cohort or group of active participants to share ideas and information from their perspectives. This technique can also bring transparency, increase trust, and understanding of complex topics like antimicrobial stewardship. Uniquely, this model also allows for a larger group of participants to observe from outside of the fishbowl. So enter into the chat, if you will. Has anybody seen the reality TV show Big Brother? And so it's kind of a funny analogy, but in a way, this is sort of similar to Big Brother. We're going to have certain people living in the house, aka our fishbowl. We're going to watch and learn, listen to what they're doing, and then we'll have an opportunity for the rest of us to be watching and learning from them. So the purpose and goal really of this project is to support hospitals in the successful implementation of an antimicrobial stewardship program. And I want to talk next about who can participate in the fishbowl. So as we mentioned, we are offering participation for a small cohort. We can accept a maximum of 5 hospitals. The hospitals can be any size, but we'd like for them to have 4 or less of the core elements in place. So that's kind of our way of saying that we're starting with beginners. This isn't a way to advance having all of the core elements in place, but it's a way to support you as you get started in implementing those elements. We will require that you have a signed letter of commitment from your CEO and team lead. So who can participate on the Sandbar? And the question is anyone. So if you're listening along today and you say, well, we have a program in place, we have all of the core elements in place currently, but we'd still like to listen in to the webinar content and try and learn, we would love to have you. You can go ahead, you'll see from this snapshot, the project overview document has hyperlinked webinar registration that is currently open for all 6 of the project webinars. So go ahead and use those and begin registering interested members from your hospital organization. This project is comprised of 6 webinars over the course of the next 6 months. One or a combination of our subject matter expert project team will be presenting at each of these webinars, and then we'll be providing the hospital fish with individualized virtual coaching between the webinars. So the aim of the coaching will be to help you digest and implement the strategies and information presented during the monthly webinars at your facility. You're going to be assigned an advisor who will work with you primarily while you maintain access to the full SME team. Hospitals identified for the fishbowl will have an interactive role in the webinars as we create opportunities for you to learn from your colleagues who are also working to implement the same strategies. I'd like to note that there was a small error in the project outline originally distributed. So on your screen, please do note that webinar 6 is scheduled for December 19th. I believe the original document said the 17th. So I wanted to point that out. So although we're not going to be getting into any specific content today, I do want to give you a high-level description of some of the topics we're going to be covering during each of the 6 project webinars. Starting with webinar 1, of course, we're going to want to introduce our hospital fish during webinar 1 so that everyone has a voice. We're going to be identifying key elements necessary that constitute a formal antimicrobial stewardship program. We'll review the CDC core elements, and then we're going to describe some options for actions that will help you meet each of the 6 core elements. Because the goal of the project is to help support your successful implementation of a stewardship program over the next 6 months, we recognize that time is of the essence. So we don't want you to wait until webinar 3 and 4, have to wait that long to the project period for you to get to action. So we're going to be starting you off with some simple yet effective ways you can get to action right away, which will contribute to your successful implementation of the core elements. Webinar 2 is on measurement, so this will bring us to August. We're going to be reviewing metrics to track antimicrobial usage. We're going to ask you to consider who's asking for the measures and for the data, and what are their goals of the measurement? Are they looking for financial information? Are they hoping to improve quality of care? Or is the information they're looking for syndrome specific, or is it for regulatory compliance or requirements as you build those measurements? We'll describe the role of NHSN reporting and review stewardship quality indicators. During webinar 3, we'll cover tracking and reporting, and we'll start by explaining why it's essential to informing and assessing stewardship actions. We'll talk about individualizing your measures as you continue to track and report to make sure that they're useful, they're meaningful to your providers, and that they can be tracked over time to assess for improvement. We'll also help you kind of consider your own unique IT and benchmarking capabilities. We'll talk about reporting to hospital leadership and also optimal timing format and delivery methods you might use. Webinar 4 is centered around optimal prescribing, the importance of pathways and clinical decision support tools, and how you might best use order sets. We'll talk about types of antimicrobial use and the difference between prophylaxis, preemptive, empiric, and definitive different usages. Empiric antimicrobial prescribing, the importance of the antibiogram and choosing wisely. We'll talk about clinical alerts and how IT might help with that. Timely de-escalation of therapy and the importance of reassessing every day. And also the utility of biomarkers. During webinar 5, we'll be focusing on pharmacy with the idea of pharmacy-driven stewardship. We'll be describing workflow for pharmacy, different stewardship processes, review common pharmacy interventions that can help improve antimicrobial use, and then describe the benefits of pharmacy penicillin allergy testing services. Finally, webinar 6 will bring us into December as we close out the end of the 2018 year with the theme of Keep Swimming, how you can maintain your momentum for success. So we'll be discussing new actions as you move forward, new diagnostic tools that are on the horizon, how you can continue success in tracking and reporting, and then different educational events. That's that 7th core element. That you might be able to start pulling in at your institution, and whether that means webinars, ground rails, different mechanisms for training your providers, your healthcare team, and also patients and families. So here are the commitments we're asking for if you'd like to have your hospital considered to be a fish in the Swim Towards Stewardship project. We'd like for you to identify an antimicrobial stewardship team lead, and we prefer that this is a pharmacist or a physician, and that you attend all 6 project webinars. We'll ask that you engage a team of key players and stakeholders to form a new or enhance a current antimicrobial stewardship program at your hospital. We'll ask that you complete a pre and post project survey, participate in monthly coaching calls and email exchanges with your assigned expert advisor, and that you be dedicated to rapid cycle learning, implementation, and improvement throughout the course of this project. So with all this information in tow, so hopefully we have a few of you asking yourselves, well, how do we get enrolled to be a fish? So I want to spend the next few slides describing the enrollment process for both participants on the Sandbar and hospitals that would like to be fish in the fishbowl. So some Sandbar reminders: there is no additional enrollment needed if you're just wanting to participate in the project in an observe-only capacity. Go ahead and, like I said, use the hyperlinks available through the project overview seen on your screen to get registered for those webinars, and we look forward to having you participate and listen in with us. If you would like to have your hospital be considered for the fishbowl, please submit your completed letter of commitment. The letter of commitment is indicated by the green arrow on your screen. That letter of commitment will bring you, verbiage will bring you to a hyperlink with the actual letter itself. On your screen now, you'll see an image of the letter of commitment, and this is a 2-page document. If you haven't had a chance to review it yet, I would encourage you to do so and contact me following our webinar today with any questions. This document requires commitment and signature from your hospital CEO and also your team leader. Leadership and accountability are the first 2 CDC core elements, and we want to make sure that participants have these items secured so that they can successfully move through the remaining core elements. Leadership commitment by hospital executives is so important to ensuring that we have the right allocation of necessary resources to support antibiotic stewardship programs. Obtaining leadership commitment to implement your stewardship activities is just essential in creating a strong and sustainable program. The accountability piece really speaks to identifying a single team leader who will be responsible for the program and these project outcomes. We strongly recommend that this be a physician or a pharmacist. This commitment letter should be signed and returned to myself at carpenter@ihconline.org, and I'll be providing my contact information at the end of the session. We'll ask that this is returned no later than June 29th. So I'm going to say those dates again. We'll ask that the commitment letter be signed and returned to Kate Carpenter at my email address provided at the end of the session, no later than June 29th, for review by our project team. We'll be reviewing all the submissions for the project, and we'll be notifying you if you are one of the fish no later than June 30th, so you can begin preparing. And I know our subject matter expert team would like to contact you and provide you a coaching session before we even get started with webinar 1. I do want to remind you that all hospitals will be able to participate in this project via the Sandbar. So due to the nature of the fishbowl design, the cohort itself will be capped at 5 hospitals. Okay, and so at this point, the most important part of this session is just that you all have a chance to ask questions as it relates to the project. So I'm going to navigate to the chat box here and see if there's been anything entered throughout the session so far. Otherwise, I would invite you to unmute your phone line and go ahead and ask any questions you may have aloud. We'll pause for just a brief moment to allow folks to do that, and while I navigate to the chat. Okay, so the first question coming in through the chat, thank you, Don, is where is this letter of commitment located? The letter of commitment is a hyperlinked document off of the project overview sheet. And Don, I'd be happy to send that out again following this webinar. It may take us a couple days to get the transcription back, but we'll be sending out a link with slides from today, along with those project documents. But I'd be happy to email it to you directly following today's session, Don. Any other questions? That's the only question I'm seeing in through the chat at this time. Give folks just another couple minutes if they have any questions that they'd like to have a moment to type in. Peggy's asking, where do I sign up for the Sandbar? Thanks for the question, Peggy. The answer is you don't have to officially sign up anywhere for the Sandbar, but what you can do is you can go ahead and register now for each of those 6 project webinars. They are hyperlinked from the project overview sheet. So if you click on those, it'll bring you directly to where you can register for each of those webinars. You'll be registered in an observer or participant capacity. And so that's all you need to enroll to be a part of the Sandbar. Did that answer your question, Peggy? Great, yep, perfect. Any other questions? Again, I'll give you just a moment to type those in. Okay, I don't see any other questions coming in through the chat. Certainly, if you think of something while we're wrapping up here, go ahead and plug it in, or feel free to contact me directly following today's session. So to recap here on some next steps, let me get our slides pulled back up here. If you'd like to be a part of the fishbowl, please complete and return the letter of commitment to me. Register your team now for webinars 1 through 6 to assist you with scheduling. And for the Sandbar, no further action is needed. Register now for webinars 1 through 6. All project flyers, informational, and promotional documents, along with today's slide and video link, will be sent out directly to all those on the call today within the next business week. Additionally, all information will be posted to Innovation. I want to thank you so much for your commitment to antimicrobial stewardship and for joining us for the call today. Please feel free to contact me directly at the contact information provided on your screen with any questions you may have following the webinar, and I'd be happy to assist you. I'll hang on the line for just a few more minutes if anybody would like to ask a question as people drop off, but this concludes our session for today. Thank you for joining.